Good morning, good afternoon, good evening, wherever you are. My name is Aros May, and I'm with the IBP Network. It is my pleasure to welcome you to today's webinar, where we'll have a chance to discuss Season 1 of The Pitch, one of the most exciting initiatives of knowledge success. This is what we'll cover today. We will have an opportunity to hear an overview and learn a little bit about the project and the initiative by Ann Ballard. Then we'll have 4 colleagues from Nigeria, Malawi, Pakistan, and India to share with us their experience and the projects under this initiative. And throughout the presentation, we'll have an opportunity to hear from you as well through a number of polls, and also hear your questions and have an opportunity to answer them. Before we begin, I'd just like to remind you that the presentation can be downloaded from the resources in the handouts section. You can submit your questions anytime. We invite you to visit the website. I'll share the link momentarily. And the webinar will be recorded. So tomorrow you will receive a link to the webinar recording, as well as additional resources that our presenters today had put together for your reference and to hear a bit more, to learn a little bit more about their projects. These are our innovators. We'll hear from Margaret Bolaji, who's the Executive Director of a Stand With a Girl initiative in Nigeria, Hester Nyasulu, Executive Director of White Ribbon Alliance in Malawi, and Mehreen Shahid from Safe Delivery, Safe Mother in Pakistan, and also from our colleague Jinsi Shako at Japaigo, India. So this is now my turn to turn it over to Ann Ballard, who is the Senior Program Officer with Knowledge Success and the team lead for the pitch. Ann, over to you.
Thank you, Ados. Good morning, good afternoon, good evening, everyone. It's wonderful to be with you all here today. So as Ados mentioned, I am a Senior Program Officer on the Knowledge Success Project and the team lead for the pitch. And Knowledge Success is a 5-year global project funded by USAID's Office of Population and Reproductive Health. And we support learning and create opportunities for collaboration and knowledge exchange for people who design, implement, and evaluate family planning and reproductive health programs and policies. Ados, you can go to the next slide, please. Thank you. So our goal on the Knowledge Success Project is to make it relevant, easy, attractive, and timely for those working in family planning and reproductive health to find and to share the information that they need to do their job well. So the project is led by the Johns Hopkins Center for Communication Programs in partnership with AMREF Health Africa, Busara Center for Health Economics, and FHI 360. So that's a bit of background about the Knowledge Success Project. And if we can go to the next slide, please. I'll now introduce the pitch. So some of you may be very familiar with the popular TV show called Shark Tank. This is a pretty popular show right now in the United States, but I've been told that there are various versions of this show called Lion's Den or Dragon's Den in Africa and Asia. So if you are familiar with this style of show, the pitch might be somewhat familiar to you. So the pitch is a series of regional competitions that awards organizations based in sub-Saharan Africa and Asia up to $50,000 each to implement knowledge management innovations for family planning and reproductive health programs. And the idea for the pitch regional competitions emerged from co-creation workshops that we held with family planning and reproductive health professionals in Africa, Asia, and the United States. So through this co-creation process, participants developed solutions to address common knowledge management challenges, and the idea for the regional competitions to fund local innovations in knowledge management emerged from that co-creation process. We are currently in season 2 of the pitch competition, which I will talk a little bit more about before we end today. But our focus today is really on the season 1 knowledge management champion innovators and the wonderful knowledge management innovations that they implemented during the season 1 competition. If we can go to the next slide, please. So as a project, Knowledge Success aims to support knowledge management champions in Africa and Asia to strengthen knowledge exchange and collaboration and enhance meaningful learning to improve family planning and reproductive health programs. The pitch competition supports this goal specifically by providing seed funding for knowledge management champions working in family planning at the national or regional level, by breaking down barriers impacting the widespread implementation of knowledge management, like the assumption that knowledge management is difficult to implement. And we do that by showcasing these creative and really practical ideas for how to implement innovative knowledge management solutions for local problems or challenges. And then finally, we achieve this goal by financially supporting the development of innovative knowledge management solutions by the organizations who know best the needs of their regions and countries and who are best placed to lead those solutions long term. Next slide. So season 1 of the pitch premiered last June, so almost a year ago, and the first season drew more than 80 innovative submissions from organizations in Africa and Asia, and over 3,200 visitors to our landing page to find more information or to hear about the innovations. And the final watch parties, where we announced the winners and had the semifinalists talk about their innovations, had more than 1,000 views combined. So ultimately, 4 knowledge management champion innovators, 2 from Africa and 2 from Asia, were selected to be awarded up to $50,000 each to implement their KM innovations over a 5-month period. So during today's webinar, the season 1 knowledge management champion innovators are not only going to be talking to us about their innovations, but they'll also be sharing details on how they implemented their innovations, what they learned, and their recommendations for others who may want to implement similar knowledge management innovations in their contexts. So we hope that you leave this webinar really inspired to strengthen your own knowledge management efforts to address family planning needs in your specific context. But before we get started with the content of the webinar today, we would like to pause and ask you all to reflect on your own experiences working in family planning and reproductive health through some poll questions that you should see very soon on your screen. So the first question that you see here is data being translated into stories in your country? Please go ahead and select yes, no, or I don't know. And you'll have just a few more seconds to do that. So is data being translated into stories in your country? All right, hopefully everyone's seeing the poll and the responses are coming in. I'll give you all just a few more seconds to respond. And this is really just a question to kind of see who we have in the room. And these are questions that are related to the presentations that will be shared in a moment. So Ottos, if we have a lot of responses for this, I think we can share the results. Great. Is data being translated into stories in your country? 48% said yes. That is absolutely wonderful. I think Margaret will be very happy to hear that. 30% said no, and 23% said I don't know. So hopefully in an ideal world, 100% would have said yes, but it's wonderful to see that 48%. That's a great number. Thank you, Ottos. Let's move on to the next poll question for you. So this question is, do you have access to a comprehensive family planning and reproductive health dashboard to access data for decision-making in your country? And please select yes, no, or I don't know. I'll give you a few moments to respond. And the question again is, do you have access to a comprehensive family planning and reproductive health dashboard to access data for decision-making in your country? All right, maybe if we have enough responses, we can go ahead and share those results. Okay, here the majority said no. So we have 47% with there is no comprehensive dashboard on family planning data for decision making. 38% said yes, and 16% said I don't know. So that is very interesting, and I think probably in line with Hester's experience. So thank you, Ottos, for showing those polls. So if you haven't guessed already, the first two presentations that we'll be hearing about today are related to data for storytelling and making sure that family planning and reproductive health data is accessible through a publicly available dashboard. So as Ottos mentioned, we have a wonderful lineup of speakers for the session today. And without further ado, I'd like to introduce our first speaker. So if you could go to the next slide, please. Wonderful. So Margaret Bolaji is the founder and executive director of Stand With a Girl initiative in Nigeria. The Stand With a Girl team strengthened the capacity of youth data advocates to interpret HMIS data on adolescent use of contraception through the creation of 5 storybooks depicting AYSRH data in various states across Nigeria. And the ultimate goal of this innovation was to advocate for adolescent responsive family planning and reproductive health programs among policymakers at the local and state level. So throughout Margaret's presentation, please be sure to type any questions that you have into the chat, and we will have time in between presentations to respond to those questions and hear from Margaret. So Margaret, over to you.
Thank you so much, Anne. And of course, it's always a pleasure to talk about the Data Made Simple project. For us at Stand With a Girl initiative, it's really a come true. So on a personal note, venturing into the development space because I was really passionate about girls and their reproductive health and education. I knew how it was so easy, and I mean easy, to win decision makers' hearts during meetings, conferences with very wonderful stories. But I know that the stories, as emotional, as good as they were, I do not usually see commensurate impact afterwards because there weren't data to back them up. And that was when I got interested in data. But then starting to attend data meeting, I noticed they were quite boring. And I was wondering why. And it happened that it wasn't just me because it was numbers. If you're not so in touch with that, it just really wasn't the best as at that time. And that's why for me, I just knew, and even as an organization, being a youth-led organization, that we could have more young person meaningfully engaged in data for decision making. And in Nigeria, we have paucity of data on AYSRH. However, the available data are not simplified enough to ensure that they're used for programming and decision making largely. Next slide, please. And really, that was what Better Data Made Simple. And what exactly did we do? With the AYS Adolescent and Youth Sexual and Reproductive Health Data Made Simple project, we produced AYSRH storybooks, and basically in 2 indigenous languages, Yoruba and Hausa, but of course in English in Nigeria. And the storybooks were filled with animated images, infographics, and we were actually using data from 5 out of the 36 plus 1 states in Nigeria. Next slide, please. How exactly did we go about producing this AYSRH storybooks? We started out with within the 5 months and had to ask for 1 month extension, making it 6 months. We started out with a kickoff and stakeholders meeting. And this was very important because we're dealing with data. We weren't going to collect new data. We're going to be working with existing AYSRH data. So we needed to bring partners on board. We also needed to speak with the leadership of the different states for sustainability to be able to buy into the project. We then went further to also engage and also provide technical support to the local government monitoring and evaluation officers. So it was key that while we wanted to bring in young people to be able to turn this data into stories, it was important to work with the for lack of a better word, the custodian of this data, people who collect this data and put them together. And those were the monitoring and evaluation officers. We also had to collate the different data because we were deliberate about ensuring that we have relevant AYSRH data that was useful for the stories, because that was basically the ingredient that we used. And importantly, which is really at the center of everything that we did, was selecting and engaging the youth data advocates. So for every of the 5 states, we have 5 young people who had experience and passion in AYSRH and were already involved in one level of engagement or sitting at different boards or technical working groups in their state to be part of it. These were young people between ages 18 to 35. We also had master training of trainers for the project team so that we can then step down the same training and even more to the state level, and then had courtesy visits to stakeholders, decision. We were working with government, we were working with the primary health care agency and board, so we needed to speak to the executive directors and all of that, and importantly was to gain their buy-in and for the project sustainability. Also, we had and that's the big event where we had the capacity building. It was for 3 days with the state actors, the young people themselves, also developing the stories, looking at the data and transforming them into stories. Because for us, it was really to analyze this data, interpret them, as well as present them in very simplified formats. And then after that, the young persons also at the capacity building meeting decided what the images will look like, what the graphics will look like, but for want of time, they couldn't come up with that. So we had to engage a graphic designer, or better still, an illustrator, to be able to bring out those images that were already illustrated by the state actors as well as the young person. And of course, the stories were developed, produced, ready. We had the state dissemination as well as the national dissemination. Next slide, please. What were the key results? One is that we successfully translated AYSRH data into simple, friendly, catchy, and responsive storybooks for decision making in the 5 states that we worked in. I'm glad to know that 48% of us already have those experiences in our state. And just to say, this is another 1% in addition to the 48%, because in this state, we have the stories translated in, or this data translated into storybooks. Also, we were very excited to see 25 youth data advocate, 5 adolescent desk officers who, of course, they had the go-to person when you talk of adolescent health issues in the state, as well as 30 monitoring and evaluation officers, and the family planning and reproductive health coordinators, as well as representatives from civil society organizations, particularly youth-led. They now have improved knowledge on AYSRH data for decision-making and programming. And lastly, the counts continue. We have over 60 decision makers engaged on promoting young people's access to sexual and reproductive health information and services, because by and large, that is what the storybook is meant to do, to engage those decision makers, to engage programmers, to engage donors, and begin to put in the right money into promoting AYSRH in the states. Next slide, please. And it was important to know that they were not just engagements or just meeting for meeting's sake. We had definite and specific commitment from those decision makers. One of such was at one of the states, they were going to ensure the capacity of service providers on adolescent and youth sexual and reproductive health service are prioritized to ensure that the facilities, the primary health care centers are youth-friendly by training the service providers, which were part of the issues that were raised, because at the end of the story, we had action points for those decision makers. We're also excited to engage even religious leaders who said they were happy to break the parent-child barriers on sex education by educating the parents. We also had commitments like from the Ministry of Education, also information rather, ensuring that This is included in quarterly bulletin publication. We also had commitments such as subsequent simplification. We know that data is dynamic, so it means that beyond just the current data, subsequent data can be simplified and made easy for decision making. Next slide, please. Next slide. Okay, what we learned very valuable lessons, and of course this webinar is not enough to explain all of them to say, but the key ones for us was one, that ensuring that AYSRH data tell compelling story in a simple, friendly, catchy, and responsive format rather, promotes its acceptability and internalization, particularly for decision makers at community levels. Because yes, science is great. It's great to have information. It should be prioritized, but it needs to be connected to the context. And that's what the storybook has helped to do, and it helps to make decision easy. Now, it also ensuring that capacity building of relevant state actors, ensure data analysis and visualization skills are embedded in government structures. So as opposed to working with the state or just some other persons that were not domiciled in the structure, in the system, we decided to work with M&E officers, with adolescent docs officers who were paid and employed by the government. What that means is that they're able to carry it forward. And now that we're no longer in the state, the skills have been left with them to continue to do a good job. Also ensuring that AYSRH data to be used in developing the story are recognized and validated. So while we wanted to ensure we had data, it was important that this data have been validated and accepted and also recognized by the state, so that we're not bringing in data. Yes, global data are good, but we needed to bring data that are relevant to the state and have been accepted as well. Also, partnering with the state to set the criteria for the youth data advocates was very important. We also included, as part of the training, value clarification exercise. Again, we know issue around sexual and reproductive health. There are a lot of programmers, participants, buyers, and all of that. So really having the value clarification exercise helped to really prepare the minds of the participants to be able to engage meaningfully and even objectively while relating the stories. And lastly, having this youth data advocates already existing in structures like the State Technical Working Group on Adolescent Health and help them to carry on the work even after the project. Next slide, please. Sustainability. So for us, again, tied to the lessons that we learned, is that the relationship that we already had with the youth-led organization and our commitment to cascade these trainings, and for the selected young persons who are members of this youth-led organization, to cascade this training to additional young people in their network, in their organization, with our support, helps to make sure that this continues to happen. We know data is dynamic, and we know it's not just a one-off translation or visualization that works, but because this skill has been inculcated, it becomes a culture and it continues to happen. Another sustainability point is the fact that the leadership of the State Primary Healthcare Board, the State Ministry of Health, help to facilitate an enabling environment for project sustainability. So meaningfully engaging them right from the start of the project, helping them to own the project really makes it go forward. And lastly, strengthening the capacity of those monitoring and evaluation officers, the adolescent desk officers who are employed by the government on this story development, visualization, has really helped them to simplify data, internalize it, and also subsequently be able to do so. Next slide. On the side, you see just what the inside looks like. Okay, and just to say that this year, and this is really good news for us, I hope it is good news to you who is hearing us, that we were able to scale up, or currently we're scaling up to 7 additional states, because we got an additional funding from Grant Challenges Canada. So as we speak right now, 5 plus 7, so 12 states in Nigeria are implementing the Data Made Simple project. And I think my last slide, as I turn it over to Anne. Yes, and of course, you can feel free to download the storybooks at standwithagirl.org. We also have a document, we call it How to Guide on Simplifying Data for Decision Making. It really gives a step-by-step processes to ensuring you're simplifying AYSRH data, and you can learn, you can adapt, you can adopt. Thank you so very much. I think I will take a pause and wait until it's time for question and answer. Thank you.
Thank you so much, Margaret. That is such an exciting initiative, and every time I hear you talk about it, I'm impressed that the team implemented 5 3-day workshops with different individuals in each state, and that the team used a co-creation style or format to create these stories together. So I think this is a very exciting initiative, and we congratulate you on receiving additional funding to scale up those storybooks. And I also want to thank Ados for adding the link to the storybooks in the chat. So if you're interested, please check those out in the chat. And please write any questions that you have for Margaret or the Stand With a Girl team in the chat as well, and we will make sure to get to those during the Q&A. So now it is my pleasure to introduce our next speaker, Hester Nyasulu. He is the Executive Director for the White Ribbon Alliance for Safe Motherhood in Malawi. Hester will be sharing White Ribbon Alliance's experience creating a centralized and publicly available family planning dashboard for decision making. And if you have any questions throughout Hester's presentation, please also write those in the discussion box. So Hester, over to you.
Thank you so much, Anne. And greetings from the warm heart of Africa, Malawi. I'll be sharing on our innovation on developing the family planning dashboard. The reason behind all this was to improve accessibility and usability of family planning data in Malawi. Now, I was really fascinated with the poll results that we've had, where 47% of you have said you don't have comprehensive family planning dashboards, and the rest said 16% said no. So in total, we can say about 63% are not really. There's the same reason that made us to develop this dashboard. And in addition to just that reason, we also noted several things in Malawi. Number one is that bits and pieces of family planning information is on the database, which is called the DHIS2. I'm sure most of the countries are using this one. Now, the challenge with DHIS2 is that it's not easily accessible, especially like for us here in Malawi. For one to access, you need to have login credentials. And these ones, you have to either write an email to the responsible officer, explain the reasons why you want to be accessing data, and where you're from, what do you do, and all that. You also have to ensure that you know who that person is. So all that process is more like cumbersome. Most people don't get to get these login credentials, and data just sits in DHIS2 with not so many people accessing. Number two is that when you get into DHIS2, it's not an easy go. You need to have some orientation for you to know where to touch, how to maneuver and navigate through the database and the various dashboards that are there. And truly, others would get to this level where they're able to access the dashboard, the DHIS2, but then later on failing to access the information that they really need. And especially for us, there was no family planning dashboard on DHIS2. So when you land there, it means that you wouldn't know where to go unless if you are told how to maneuver around to get bits and pieces of the information. And the challenge is that apart from the DHIS2, we couldn't have any other platform where you can access comprehensive family planning data. Now, what do we mean by comprehensive? We're looking at issues of accessibility. We're looking at issues of stockouts. Now, if for one to be able to understand about stockouts, you'd need maybe to go into LMIS and not particular platform that you are in, and for you to access that. And then also on the reporting, where is this data coming from? All that information, it's tricky to get in one dashboard, but this is exactly what we pursued. Next slide, please. So in order to do this, what we did was, number one, develop the family planning, a comprehensive one, family planning dashboard on DHIS2. And then we also worked to develop an external link for the DHIS2 family planning data so that one can be able to access without login credentials. And then we also wanted to link, which we did, linking the family planning dashboard to MOH, which is Ministry of Health website. And lastly, worked on increasing awareness about DHIS2, but also the family planning dashboard. Next slide, please. So this next slide shows the landing page on the initial DHIS2. So as you'd see, I know maybe you may not have much time, but there is no dashboard there for family planning. So when you land there, you wouldn't know where to go to find family planning data and bits and pieces, and where do you go to find, let's say, stockout labels and all that. That alone, just seeing this, would be very tricky for one to do. So if you go to the next slide, what we did was now to create a family planning dashboard. So as you'd see on the tabs up there, the first one, which is with a star, is a family planning dashboard. So if one has login credentials in Malawi for the DHIS2, you can be able to access and log in. And then when you log in, you find a family planning dashboard right there, and you just click, and this will be the information that you start to see about users. And we just picked this one where it's showing short-term planning methods, and there are condoms there, injectables, and oral methods, and you have data showing the uptake in that way. Next slide, please. Now, the second thing that we did was to create an external link, and we did that using Tableau Public. This one you don't have to pay. Once created, it just goes. And with this link, it's linked now to information in the DHIS2, and it has got those tabs that you see up there, family planning usage. It also has access and stock availability. And then you also have the reporting rate and also location where this information is coming from. Now, if you see on your far right, you'd see up there, you can select the districts. You want a particular district, you'd pick that. You want all, it means that it's a whole country, all facilities in Malawi. And then down that side, you can also select period where you want. Is it 3 months, 6 months, a year, depending on how you need this data. Now, as you'd see, the dashboard, it can clearly show you uptake you know, just by checking. For instance, there, as you're seeing, permanent family planning usage, vasectomy, it's not even visible. It shows that most men are not using family planning, the permanent one. Most men are not vying for vasectomy. And you need to discuss already in terms of decisions on how you'd want to reach out to men, understand what are the reasons behind this. All those things would come in just by checking on the dashboard for you know, decision makers to actually find out more, or else come up with interventions that can help out in terms of uptake, or even is it an issue of stockouts, and you act on that. Next slide, please. So this one is just the same. We were just trying to show the link on the access and stock availability. So that's the uptake. As you would see, number of women accessing family planning methods. As you'd look at the graph already, the question would come, why this drop? If you're looking at the graph on your right, what's the why this drop? You'd actually engage family planning coordinators, understand the situation on the ground, and things would come up in that way. Next slide, please. So these are the links. If these would be shared on the chat box, please feel free to click on them. So we've made sure that the family planning dashboard is accessible. The first link is the public Tableau link. So you click that, you'll be able to get the information. The other one is on websites. So the first one is on Ministry of Health website. We have on Population and Development website, and we also have it on White Ribbon Alliance Malawi website, the third one. And we are working with other organizations to also have this link on their platforms. But what it means is you can now access this information, and we feel it's accessible and useful for all key stakeholders in family planning, starting with the service providers themselves to understand what's happening in other areas or even in their respective facilities. And we are looking at parliamentarians who have an oversight role on what is happening in the Ministry of Health. We have CSOs who are mostly advocates, and others supporting service provision. They need to also see where gaps are and how they can support. We also have academia, people that are writing research. They would find this information useful. Actually, we were commended during the presentation by one of the lecturers who said, no, this would be very helpful to our students because they'll be able to access. Some of them were doing a research on family planning access in Malawi. So this is the data that is readily available for stakeholders in Malawi and beyond. Next slide. So we made sure that people need to be aware about this dashboard. So we developed an infographic, and they also made some few presentations, and the key target people were the family planning coordinators in all the districts in Malawi. And we also targeted CSOs, a minimum of 10 in each district. So in Malawi, we have 28 districts, and then national CSOs, and we engaged stakeholders in the family planning and safe motherhood technical working groups, and we also engaged the Ministry of Health senior management team on this. So at the moment, a lot of our stakeholders in Malawi are aware of the dashboard. We still need a lot of work to be done to reach out to more so that everybody on the ground is aware. When we're presenting this in one of the districts, They even said, no, we need this kind of link for other programs, for instance, HIV, condom uptake, something that people can easily access. So that will be maybe on our next assignment, to look at how we can expand beyond family planning, but also make sure that a lot of people are aware about the dashboard and are able to use it appropriately. Next slide, you just find our acknowledgement to Knowledge Success for entrusting us with this work. And that's what we did. And thank you so much for your attention.
Thank you, Hester, and congratulations again to the White Ribbon Alliance team. We're really impressed with how the dashboard came out, and we know that this is an innovation that was needed and will be incredibly useful for those working in family planning in Malawi. So now we have some time for question and answer for Margaret and Hester regarding the Data Made Simple storybooks and the Family Planning Data Dashboard. If you have any additional questions, please feel free to type them in the chat at this time and we'll make sure to address them. But as of now, we do have a few questions that I can start with. Hester, the first question here is for you, and it came from Bikash. The question is, why Family Planning Dashboard is easily unavailable to common people? So the question is, why is Family Planning Dashboards easily unavailable to common people?
Thank you so much for the question. A number of factors. We couldn't point to a particular issue, but the question of why is the answer is it's not necessary. We all need to understand this information, and everybody needs to know what's happening in terms of uptake. It will also motivate you to take up the family planning method, or even just in general to know the landscape in a country. That's very important, and that's why we would want this data to be available to everyone. It's just now what I'm seeing are the technicalities that are there. For instance, all this data, you'd find it in bits and pieces within the DHIS tool, and the initial thinking is that this is most probably for decision makers and be the programmers themselves, and yet it's something that needs to move across. And our dashboard is just an example showing that we need to have this information to everyone who needs that information. And a common person, as you have pointed out, is that person that needs to check on this data and understand what's happening in family planning cycle, and would help this common person to make a decision on which contraceptive to go. So that's an assignment we have across. Thank you.
Thank you, Hester. Our next question here is for Margaret. Margaret, what was the biggest challenge that you faced in terms of implementing the storybooks?
Okay, thank you so much, Anne, for your question. So for us, one big problem and challenge, as some of us may know, is the fact that Nigeria is going through some humanitarian issues, and we have security issues like banditries, and there were some of the states, two particularly out of the 5, that were located in the northern place. So we had to hold on and even postpone meetings just to be able to get security reports and be sure that it was safe enough. At some point, we considered having it virtually, but because it needed to be hands-on, we had to postpone it. But we're grateful that we're still able to still have this meeting. Another challenge we also faced was while selecting the youth data advocate, we had criteria, but the age, some who were older wanted to come in, and it was just really trying to find a balance between the right set of people to engage who would also be value add, of course bringing the experience that they already have. But we're glad to be able to really overcome all of those challenges and come up with the storybooks.
Thank you, Margaret. All right. Let's see here. So one more question, unless some others come in. This next question is for Hester. So Hester, what lessons or recommendations do you have regarding working with the government to create and then maintain this dashboard? If others were interested in working with governments, what recommendations would you have for them?
Thank you so much for the question. So the first part is really to define the problem. And that has to be done together with the government counterpart. The problem here is access. Just as we've done the poll here, where it's showing 63% do not have access to comprehensive family planning dashboard. It's the same thing that we did among family planning stakeholders in Malawi, where we asked this question: are you able to access family planning data? How? And we're talking to family planning stakeholders. The numbers were quite low. And we said, this is a problem. Now, how do we move in to solve the problem? When you reach that stage, you will have started getting there. Now, the second part is now where government has to be flexible to allow that information can be made public. That's another part. So you need to discuss on security, what type of data you're looking at. In this case, when we're looking at family planning data, there was no issue to do with security, and also making sure that when you're making the link, it doesn't give access to others to hack and go into the dashboard itself in DHIS2. Once you address those concerns, then you're good to go. Government should be able to give you a leeway to do an innovation as we've done. Over.
Great, thank you. And we did have some additional questions come in. Thank you for that response, Hester. This next question is for Margaret from Avindra. The question is, how easy or difficult was it to engage religious leaders and get them on board? And I think we'll have just a few more minutes for this Q&A.
Great question. Just like we said, so while it was important to always let them see the data, so that in some cases, even when we know that, for example, the number of young people already having sex, whether we provide them with the information and not the consequences of unsafe abortion and all of those things, tears to the eyes using the data, just because we're able to speak to the young persons and apply it to the context, it looks really far away from us. Or where is this global data coming from? It doesn't speak to members of my community. But the fact that we have this youth data advocate who could speak to the reality in addition, so it was shaping and giving life to data. And when they read the stories, they could relate with it. And also engaging them and just borrowing from what Hester said, having that visioning meeting where they were able to come together to say, these are real problems and how do we solve it? This is the best way to do so. And having those young people lead the conversation. Those are young people, they are familiar with members of their community. Was really easy to have them buy into the storybooks and say, yes, this is what we need to do. We've seen the consequences, we've seen how important it is, and we'll begin to even use our platforms, either the church or the mosques, to begin to educate parents on the importance of parent-child communication and access to sexual and reproductive health information and services. Thank you.
Thank you, Margaret. And we have 1 minute for one final question that's come in from Hend. This question is for Hester. Are there any plans to incorporate survey-based family planning indicators in the dashboard?
Yes, we do. That's why we were saying we want to expand. And one other area is that one that we want to also have data from surveys to be linked. If not, then we want to make sure that dashboard has got some links where one can easily access even other surveys that are happening on family planning. So that we want to do and expand and this scope as well. Thank you. Over.
Well, thank you again, Hester and Margaret, for a wonderful presentation and really thorough responses to these questions. If anyone has any additional questions, please type them into the questions box, and I'll ask Hester and Margaret to please respond to those in the chat. So thank you, and we can move on to the next slide here. So before we introduce our next two speakers for this session, we wanted to pause again and do a quick poll to ask you some questions about the topics that the next two speakers will be discussing. So we can go ahead and launch the poll. You should all see a question that reads, does your country collect data regarding postpartum family planning for decision making? Please go ahead and select yes, no, or I don't know. I'll give you just a few seconds to fill that out. Does your country collect data regarding postpartum family planning for decision making? Right, it looks like quite a few of you have already voted. If we want to go ahead and show those results. Wonderful. Well, I think Mehreen will be really happy to hear that 61% of you all said yes, 25% said I don't know, and 14% said no. But that is very interesting. All right, thank you all for participating. If we could go on to the next poll question, please. Wonderful. So the next question is there one platform where you can find information about family planning and reproductive health from various organizations in your country? Yes, no, or I don't know. And I'll give you a minute to respond here. Just to repeat the question is there one platform where you can find information about family planning and reproductive health from various organizations in your country? All right, let's go ahead and show those results. Great, so 50% said yes, that they do have one platform where they can go to find information that they need. 44% said no, which is pretty high, and 6% said I don't know. So I think this will be really interesting for Jinsi to talk about in her presentation. Wonderful, thank you for showing those polls, Ados. So I am now excited to introduce Mehreen Shahid. Thank you. So Mehreen is the founder and chairperson of Safe Delivery, Safe Mother in Pakistan. Mehreen will be sharing about the organization's experience conducting participatory in-person trainings on postpartum family planning for skilled birth attendants, and also data collection, analysis, and dissemination trainings with the health department. So throughout Mehreen's presentation, please feel free to ask your questions in the chat, and I will hand it over to you, Mehreen.
Thank you so much, Anne, and thank you everyone for tuning in today. As part of the pitch, conducted postpartum family planning and data management trainings. But before we go into the detail of that, I'd love to show you a video to give you a quick insight into the work we do in the field. So, Alice, if you could please play the video. Thank you. Thank you so much. If we could move to the first slide, please. The next slide, please. So we basically identified two key areas of need within the family planning space in Pakistan. The first one being that there is a need to increase acceptance, use, and uptake of contraception. And this is specifically even more applicable to Punjab province, which is the largest and most populous province of the country. So in response to that, we essentially worked to strengthen community-based delivery of quality services through primary healthcare facilities. So we trained government-deployed skilled birth attendants of the Multan district, which is one of the largest which is actually the largest district of South Punjab, which is less developed compared to the rest of the Punjab. So we basically did that through participatory hands-on trainings. Next slide, please. In the second element, we also looked at data management. If we could move to the next slide, please. So in the second aspect, basically, we looked into data management, and we highlighted that there's a need to improve the quality and accuracy of real-time maternal and reproductive health data that's captured. Now, this is essential, and what's very interesting in Punjab today is that there's a move has happened from paper-based collection of data to online application platforms. So as they're in the process of integrating the work that they're doing in the field, the provincial head office in Lahore is the one that receives data from all 36 districts of Punjab. So it is important to strengthen their data analysis and capacity skills so that they're able to not only use real-time data for their daily tasks, but this also translates into provincial policy decisions, surveillance, monitoring, and program design in the space of both maternal and reproductive health. So we worked and taught them the skill, the statistical tools data, which is an important tool needed for them to understand how to work with data, how to analyze it, and how to present it. So these are the two areas that we worked with as part of RKM innovation. If we could go next. Our implementation approach as part of the pitch was that we basically did hands-on trainings. So Alice, you could just move to the next slide, yes. So we conducted participatory hands-on in-person trainings with the skilled birth attendants, essentially SBAs in the Multan district. And we focused to simulate the scenarios that they deal with in their daily work, as well as providing them with the opportunity to practice the learned skills with actual clients, as we had set up training sites at the largest public hospitals of the district. A second element of that is that we created and captured postpartum family planning indicators. We basically developed a tracker tool, which is very unique because it was designed in the local language given to the SBAs to report monthly data on. And that collected data on counts, removals, refusals, and switching of contraceptive methods, which is currently not being collected. So we'll go into more detail on that later. The third part was the management information staff, the MIS staff that we have trained on data collection, reporting, and visualization, with the focus that the taught skills are integrated into their daily practice. And lastly, during the scope of the project implementation period of 5 to 6 months, we conducted regular follow-up monitoring visits to ensure acceptance, use, and uptake of the taught skills. If you could please go next. Essentially, the implementation approach that we had for both the PPFP trainings and the data management trainings in Lahore, so essentially into different districts of the Punjab province. If you will go to the next slide, please. So what we did during the course of the project was that we developed a set of very comprehensive quantitative and qualitative indicators to capture impact. And that is important because not only is it important for us to understand what we're doing well and where we need to improve, but these are lessons learned that can be shared with partners, donors in Pakistan and globally as well. So first, we did a pre and post test for postpartum family planning. The interesting thing is this skill was taught to SBAs for the first time. They were not acquainted with the postpartum family planning methods. And we saw that there was an increase in the data, in the knowledge that they gained from 58% to 89%. This was done to an anonymized multiple choice questionnaire, which we administered for all participants. Then over the course of the training, after the training and over the course of the implementation, we conducted observation-based assessments. So we went to basic health units to see if SBAs were using the clinical tools provided by SDSM, which included giving them step-by-step techniques on how to counsel patients using the gather method, step-by-step techniques on the DEMPA injectable, PPI-IUCDs, use of IUCDs. And over 85% of SBAs reported that they were using that, as well as the MEC wheel, which we basically gave them a translated version in Urdu to increase acceptance and understanding. And it's important to note that they were also not familiar with the MEC wheel. So seeing such a high uptake, I think was very not only heartening, but was also, indicative of the need that if you have these important tools at primary healthcare facilities, the impact and the outreach is just simply massive. We also conducted interviews with and focus group discussions just to get more deeper insights, through which we saw that younger, less experienced, unmarried SBAs generally face more challenges when they're counseling, when they're administering PPFP methods, when they're dealing with personal barriers as well. The tracker tool is something that we designed to capture the indicators that have not yet been captured in Pakistan. It was a pretty simple paper-based mechanism that we devised for them to report monthly data. And we got very interesting insights, such as, most refusals of voluntary methods take place after delivery. Women are not keen to have sort of another procedure after delivery. They commit to coming 4 to 6 weeks after delivery. And switching of methods only happens when there's side effects that they're dealing with on a regular basis, because women don't usually come to health facilities for regular checkups. So capturing this data was not only important to see the insights of realities that happen in the community from the clinical perspective, but also give insights into client preferences and behaviors, which are very important in the acceptance and uptake element of postpartum family planning services. And then on the MIS data side, we were able to support the staff to integrate data as a statistical tool, which they were also learning for the first time in their reporting, in their collection, in their analysis, most importantly, of data that they use in their work to report to the department, and also to have discussions around the work that they do. So all of these elements were quite comprehensive, which we have captured through a final documented detailed report that I authored on our project, which has been shared as a handout as well. So everybody's welcome to view that in their own time to get more insights into the work that we did. Alice, if you could have next, please, next slide. So after going on to from the impact, we also look into the lessons learned. The lessons learned is not something new for us, because we've been working in the rural, remote, challenging communities. So the thing that's important is, of course, value strong cultural beliefs. It was very interesting when I went into the field and I talked about family planning. The response I used to get is, you want us to stop having children. And that was quite eye-opening, because I was like, the focus is healthy spacing and timing of children. But if they don't perceive it that way, then it's very difficult to get through. And there are times when you're not able to get past deeply embedded local norms, so you have to work around that. So I think important to look into that. The second is challenging rural environments where literacy levels are low. There's limited accessibility in rural areas with outreach. So that is something a challenge that we faced. So we had to make sure that we developed our methods and our systems in such a way that we were able to collect data accurately and quality data that was complete from SBAs. So being mindful of this is very important. Third, of course, partnering with the government is amazing in terms of outreach and impact, but there are logistical and institutional constraints that come in the way. So you should preempt that. Something as simple as SBA's training schedule and adjusting our training schedule within that, given the short time period, can be a significant challenge amongst others. So looking into that is important. And then, of course, with the pandemic, there was a major shortage of FP supplies in Pakistan. So it's important to have the availability of supplies when you're training staff to execute it. The situation, of course, has improved a lot, but I think the reaching full capacity still remains to be seen. If you could go to the next slide, please. Then we also looked at sustainability, which is a fact. We looked at the achievements that we were able to get over the course of the project. The first was training SBAs for the first time on postpartum family planning skills, being able to conduct robust training, monitoring as well, and collecting indicators from them. Second was our content is easily replicable. So we can easily have that integrated into the department's existing programs, scaled across other districts in Punjab, owned by the department to other provinces, and in fact, countries that have similar challenges. We use local languages, which really enhance the understanding and acceptance of SBA, so and their patients in turn, right? The curriculums and all. Strong social media engagement is also very, very important. So we look into how we are engaging with different audiences, why it's so important to raise awareness on maternal and reproductive health in Pakistan and the role people can play. And the fact that we captured new PPFP indicators, which we've highlighted and shared, is absolutely instrumental for partners, for donors, for governments working in this space to get deeper insights and to be able to design data-driven programs. If you can move next, please. So we looked into the sustainability element, and a lot of the sustainability work, a lot of the focus that we had on sustainability kind of translates into our recommendations. So
Mehreen, we're no longer able to hear you. Let's see if Mehreen's able to come back.
The sustainability element. That's basically looking at what needs to be done when you're implementing a program like this. Aris, if you could please move to the next slide on recommendations. So it's important to partner with government because that outreach and scale is unparalleled. Second, you need to develop materials that can be replicated with ease with government ownership. That basically allows them to scale at a level that the private sector can simply not. Implement in local languages and support local cultures and beliefs and inculcate those into your curriculums and materials because that's what is actually well received. And then capture and share impact, which is absolutely essential in the work that we do so that we are able to help partners doing similar work, but we're also able to learn from the lessons of the field and able to implement that further. So thank you so much. This is just a quick insight into the work that we did. Thank you so much.
Thank you, Mehreen. What a wonderful and comprehensive presentation. And I'm always impressed to think that you were able to train 165 skilled birth attendants in just 5 short months using a very participatory training method and also work with the government on those data trainings. And not only train those SBAs, but follow up with them as they tracked new indicators. So wonderful job to Safe Delivery, Safe Mother in Pakistan. I am now going to hand it over to our next speaker. However, if you do have any questions for Mehreen, we will have time for Q&A, so please type them in as we go. But now I'm very pleased to introduce Jinsi Chacko. Jinsi is the Communications Officer at Jhpiego India, and she'll be sharing about Jhpiego's experience creating FP Connect, which is a centralized knowledge management system for family planning and reproductive health professionals in India. So Jinsi, over to you.
Thank you, and Srikal Adab, Namaste to everyone from India. So can we move to the slide, please? So before we discuss about the problem, I want to give you all a situation to visualize. Consider yourself visiting a library, any library, school library, college, public, any library, and just visualize a library being unorganized. The library has all the resources you are looking for, but they are not cleanly segmented, not categorized. They're just haphazardly placed. So eventually, even if the information is there, the resource is there, but you're not able to access it. So is that really a helpful situation? Despite having the information, you're unable to access it. So this is pretty much the situation what India has been facing in knowledge management for family planning and reproductive health for a very long time. And now that I have explained you the situation, the problem statement with an example, so which eventually brings out 3 important points of having improper knowledge access, and which is because of mismanaged and unorganized information, and because it is mismanaged and unorganized, that at times more often is outdated and not updated. Can we move on to the next slide, please? So eventually the problem gave up some outcomes which were not helpful for the family planning and reproductive health organizations working in the country. So there was a lot of effort application. The resource was being wasted in terms of money, in terms of government's efforts, in terms of organizations' efforts, in terms of CSR, corporate social responsibilities, and in some countries it is considered known as a corporate philanthropy. So because of this problem, despite having the knowledge and information, but the organization still struggling to adapt learnings and key information that they can implement in their respective programs, led to a lot of duplication. Next slide, please. So this surfaces the need, which we often as FPRH professionals would connect over a coffee, the need to have a one roof knowledge management platform. And since we are in the digital world, this can be done with the help of technology for effective dissemination and collation. Next slide, please. So with the pitch coming in with season 1, inspired with the Shark Tank challenge, we saw this opportunity and a great thing where we saw, okay, this is the time when we can actually make the most of this, and we pitched our idea and we won the challenge. Next slide, please. So the solution we came up with was is FP Connect, and where we are intending and focusing on networking, building, and growing the knowledge landscape of family planning and reproductive health in India. Next slide, please. But in doing so, there was a challenge, because last year, we all are aware, India has been in the news for how the country struggled with the COVID-19 pandemic and the second wave hitting the country really bad, and civil society organizations and the governments and all the implementation partners standing together, keeping the country intact and really addressing the need at the moment. It was really hard for us to bring everyone together in person, virtually, to ideate, to discuss on how we can have a common platform, a co-owned platform, a co-managed platform for family planning and reproductive health, and having this meeting, despite while the virtual connection has been really helpful to the world, but for the public health sector in general, it has been a really hard time, and bringing everyone together was a challenge that we faced. But eventually we came out of it. Yeah. So can we move to the next slide, please? So the journey of implementing and coming up with FP Connect was that in June 2021, we won the challenge, and followed by that, we conducted a series of co-creation workshops for which we'll be forever grateful to Knowledge Success for helping us understand and taking us through the art and the implementation part of how to conduct co-creation workshops, and how to jot down, document every organization's key observations and comments, and how best we can put it together, collate, and put it out in a web sort of a platform. So while this timeline gives only key bullet highlights of the entire journey, but I should mention that we had back-to-back many co-creation workshop on research, communication, making the best use of social media, managing and visualizing data, and upon which, once we clubbed all our learnings, we formed a core working group around September last year, and where there were close to 10 to 12 organizations who have been working in India for a very long time, just like Jipaigo, and have gathered, amassed knowledge and experience, and from their experience, we banked on creating collated documented information on how best we should proceed on managing the knowledge. So towards the end of September, we had a go-ahead from the Ministry of Health and Family Welfare, Government of India, where they were very pleased. The government was very pleased to know that Jipaigo, along with various development partners, were willing to come up with a knowledge management forum, FP Connect, and with this, we had their blessing, and they were very pleased that we came up with this idea. And finally, in October 21 last year, we launched the platform officially in a hybrid mode, where we had attendees in person as well as connected virtually. Next slide, please. So to talk about the key features of this platform is that we have resources, jobs, and events focused around family planning and reproductive health. Resources are further segmented into 3 categories: family planning, reproductive health, and gender-based violence. They are further neatly subcategorized under various sections for the professionals working in the domain to go straight deep dive into the resources section available, and all the materials which are uploaded there, and in a very intuitive manner with no hassle, and it is very very easy to access. Next slide, please. So the key features, apart from the assets, have been that we took inspiration from social media. We didn't want this to be just a digital library of a sort. We want people to engage, to participate. So we took inspiration from social media, where people can like, comment, share, make their own profile, set up their own list of activities they have done without consuming the data, without consuming storage in this space, and being very data friendly, and build a community similar to Reddit and Quora, where they can exchange, have discussion forum, and just favorite by clicking on the heart icon and saving it for the later read. So we just wanted this to be a holistic experience where they are able to connect and network, and reach out to other organizations, a common platform where they can just simply exchange resources and knowledge. Next slide, please. And in doing so, once we came up with the platform, we did a thorough, very active dissemination of its availability. We shared with the world, with the countries, with the states, various states in India, that we are FP Connect is now live. So we leveraged on social media through Twitter and LinkedIn. And the reason we went with these two particular social media channels being that implementation organizations and governments and all professionals prefer Twitter and LinkedIn. So we reached out to colleges, public health institutes, and we shared about its availability for people to learn. And since we strongly believe knowledge is free for all and is everyone's right, so we just reached out and shared with everyone that FP Connect is now in India. And this is a common one-stop knowledge hub for everyone seeking information on family planning and reproductive health, which before FP Connect, every individual or organization had to pretty much work from the scratch and look for resources available across organizations, which were pretty much working in a silo earlier. As I mentioned earlier, the information being scattered led to the hassle of finding knowledge and resources. Can we move to the next slide, please? So the impact of FP Connect is still growing. We are building, and since it's been just 5 to 6 months, we are growing, and we have numbers evolving, and we keep on seeing increase in figures every single day. We have new users registered every day, and we have a post increasing every day. We have over 20,000 sessions in a day, and the total number of jobs also on family planning and reproductive health domain keeps increasing. And our content management team is ensuring that we keep updating them all the time. Can we move to the next slide, please? So for us to share key learnings and recommendations to other organizations and countries have been that as we say, the old saying, teamwork makes the dream work. So for us, networking with other specialist organization in FPRH has been very helpful. Taking notes of their experiences have been very helpful. So had this been just a Japaigo's initiative, I'm sure it wouldn't have been as effective, but we consulted the specialist and we marketed in the best possible way, reached out to organizations and public health institutes to share its availability. Next slide, please. So the future, currently we are managing the FP Connect via internal resources, and we are merging it with a collaborative network and integrating with a larger reproductive health program. So for this to sustain and keep the momentum going. Next slide, please. Oh, yeah, so with this, I conclude my presentation. Thank you.
Thank you, Jinsi. It was wonderful to hear about FP Connect, and I have had the privilege of creating an account and poking around on the website, and it is incredibly useful, and I can't reiterate how important it is to have one place for people to go to. This really helps minimize information overload in the family planning and reproductive health sector, which I think we're all probably familiar with. So wonderful job, and thank you for your presentation. We now have some time for questions for Mehreen and Jinsy, and we've had a few come in. Jinsy, I'll ask you this first question. How is FP Connect different from FP Insight? And would you see this as a duplication or complementary to FP Insight?
Well, FP Connect is very, very focused on India-specific knowledge, and we are focused on giving ministry-approved resources. With ministry, I mean the government of India-approved resources, and which at times are not in, which runs parallelly with the global standards of implementing FPRH initiatives in India. So this is very customized to Indian dynamics and socio-political situations and various regions. So it is based on the on-ground learnings from other organizations. The resources are very specific to Indian geography.
Thank you. And our next question here is for Mehreen. I also want to share, Mehreen, that Narmeen in the chat said that SDSM is doing fantastic work, and congratulations. And then we have a question here from Shadab, who said, what is the process to track the client?
Thank you so much, Narmeen. Thank you so much for the question. So the process of tracking the client essentially is we're facilitating the public sector reporting platform. So what they do is they're functioning, SPAs work in their basic health units, and they're reporting data on the clients and the uptake. So what we basically did is we liaised with the government to get our own reporting alongside theirs for the purposes only of the pitch. But the way to track the client is that the client is actually being properly officially documented on their systems already. And the approach that we do is that we want to integrate into the public system, not create any parallel system that is not sustainable.
Wonderful. Thank you both. Please feel free to type additional questions into the chat here. Let's see, we do have one question that came in from Onyinye. Thank you for the great presentations to both of you. For Jinsy, can you elaborate on the FP jobs that you mentioned are available on FP Connect?
Yes, so our content management team goes through the job boards, and we filter out specific family planning related opportunities which is available in the country, and not just at the national level, but also in specific regions, in states, in provinces. So because this information, the jobs availability is also very scattered, so we try to bring everything together under one roof. So, so these job opportunities are also very specific, whether they have language requirements, whether it is specific to specific geography. So this is also being taken care of. So I hope that is what the question was, the more detail that was wanted.
Yes, I believe so. She said, thank you. Wonderful. Well, thank you so much, Mehreen and Jinsy. It was a pleasure hearing about your innovations, not only what you did, but how you did it, which I think is really important that we all talk about in meetings such as these. And I want to thank all of the Season 1 Knowledge Management Champion Innovators for being champions of knowledge management for family planning and reproductive health. And I hope that everyone who joined this session today leaves with some inspiration of how you might implement or strengthen your knowledge management efforts in your own contexts. So thank you, Mehreen, Jinsy, Hester, and Margaret. A big round of applause to all of our speakers today. Ados, if we want to move on to the next slide, we just have a few minutes to close the webinar. Wonderful, thank you. So we just premiered the watch parties for Season 2 of the pitch earlier this week. And if you missed it, I highly recommend that you watch the episodes to hear the amazing innovations that were pitched and ultimately see who won the pitch Season 2. And I'm happy to announce that we selected 5 knowledge management champion innovators, 3 from Africa and 2 from Asia. They were selected by a panel of judges to receive $50,000 each to implement their innovations over the next several months. So you can see them on the slide here. They are Blind Youth Association Nepal, Population Foundation of India, Projet Jeune Leader Madagascar, Save the Children Kenya, and Strong Enough Girls Empowerment Initiative. And I see that some of them are joining the webinar today, so that's wonderful. I recommend and invite you all to follow the Knowledge Success Project to stay updated on the progress of the Season 1 Knowledge Management Champion Innovators and also the Season 2 Knowledge Management Champion Innovators. And also just to note that very soon, Knowledge Success will be publishing more about the experiences of the Season 1 KM Champion Innovators. So all of the innovations that you heard about today will soon be available on the Knowledge Success website as well. And just to close, I want to say that the recording and presentation from today will be shared with you all in the coming days. And please, here is our website, subscribe to Knowledge Success and read more about the pitch. And thank you all so much for joining today. It was a pleasure speaking with you, and thank you for your wonderful questions. And thank you to our panelists for your wonderful presentations. Have a great day, everyone.